This presentation is brought to you by Kaylin Darnell and Katarina Trost. Today we will be talking about STI prevention. First, we need to know what an STI is. An STI is a sexually transmitted infection. Most common types are chlamydia, gonorrhea, HIV, and syphilis. And here off to the side we incorporated a visual that shows the multiple different types of STIs, along with the last three boxes it tells you the three most common symptoms, so pain with urination, pain with sex, and discharge from the genitals. So it is also important to know what signs and symptoms are common with STIs and when to seek medical attention. So symptoms usually appear 2 to 6 weeks after exposure. The first signs are fever, headache, sore throat, achy muscles or joints, and red rash on the body. Common symptoms are vaginal, penile, or anus discharge, pain with urination, sores, blisters, ulcers, warts, or rashes in the genital area, pain in the scrotum or testicles for males. When to seek medical attention. When you have burning sensation when you are urinating, tingling, or discomfort, it's always better to get tested. So when you go to the doctor to get that medical attention, make sure you get tested to see if you have an STI. So how are STIs transmitted? STIs are primarily transmitted by person-to-person contact. It could be through unprotected sex, such as getting blood, vaginal secretions. It could also be through needle reuse, and it can be given from mother to child during pregnancy. How to prevent STIs? So the most important thing we need to know in preventing STIs is practicing safe sexual practices by using condoms or even female condoms. Be sure to be vaccinated for the human papillosis virus and hepatitis B and C, and also reduce the number of sexual partners you may have. So here we talk about safe sex practices for same-sex partners. Partners should use condoms at all times when performing sexual activity in order to protect themselves. They should be honest about their STI history. It is important because their partners need to know if they've previously had chlamydia or gonorrhea and if they've been treated for it. They need to be educated about the awareness of STIs. Homeless females are more common to get STIs, approximately 16.7%, because of their careless sexual behavior, or they may not have the education that most people have about the risk or the importance of safe sex practices. They need to be more aware of their partner's sexual history and be considerate of the long-lasting risk. So fun fact, everybody, female condoms do exist. So here at the bottom right, it shows the difference between a male and a female condom. And then here in the top left, it shows how a female condom is inserted. So there is protection for everybody, and everybody should use protection no matter what. Alrighty, so this is the end of our slideshow. So now it's your turn to tell me what you learned throughout this presentation, and hopefully it was helpful for you all. Thank you. Have a wonderful day.